6 here on a Wednesday. Time now for the Woodlawn Health Report with Woodlawn Hospital. Good morning, Brad Rogers. How are you? Chris also joining us, and you've got a special guest today.
We do. We have Lindsay Brooks here as well. She's our infection control and employee health director and nurse. So we'll be getting to her here shortly.
Awesome. Can't wait to talk to her.
Absolutely.
How's things going at Woodlawn?
You know, we're on that 78-day mad dash.
Who's counting?
But, yeah, that's right. But who's counting? You know, I've talked to groups over the last several weeks in the community, and the thing that you guys are going to hear from us over and over, to the point where you probably want to poke us in the eyes, is Epic. We are moving to that new computer system in 78 days.
Okay.
And so we're at the beginning of the wave of education starting today. And so it's going to keep pushing all the way through that second week of June. It'll go all the way up until about the 12th of June, I think, is our last class before we go live on the 14th of June.
So that tells me that I've got 80 days until my birthday. So thanks.
Is that how that works?
Yeah, thanks.
We're here to help in any way we can. Absolutely. But yeah, a lot of really good work going, and we're looking forward to it. It's going to be great.
Remind people a little bit about it. Obviously, this is going to be an app that you have an app now, but you'll be going to another one, more efficient.
So Epic in general is a complete system-wide computer system. It will replace the computer system we have inside the hospital, as well as the computer system, which is totally different, that we have in the clinics. So we will have one computer system for all of your information. That computer system that we chose happens to be Epic. Epic is one of the largest in the entire country. It's considered the Cadillac of all computer systems and health records. And what it will also allow you to do is get down to what you said, one app.
Yeah.
And so the app will be on your phone. It's called MyChart. And it will allow you to pull in data from any facility that uses Epic across the country. And so if you go to, let's say, a laboratory like QuadMed that happens to use Epic, those results are in there right now. But if you then in the future go to Woodlawn, well, those results will be there as well. Yeah. And your physician or nurse practitioners will be able to pull that information from as far as, Cleveland Clinic in Palo Alto, California at Los Alamos Center there, all over the country. Right. You'll be able to pull that data forward. So that's exciting news for us.
Especially for maybe people that travel, that they might get sick on vacation or something. That information will already be there, and they won't have to worry about, well, we got to get your information from back in Rochester if you're out in California.
Well, absolutely, and vice versa. Think about how many people who are snowbirds who live here, and they go to Florida, December, January, February, and March. Well, now all of the work that they've had done here and all the information here will be accessible to their providers there. Right. And when they come home, anything they've had done in that time frame, the primary care physician here will be able to pull it in. So, very much looking forward to it. A lot of work, and the team is doing an amazing job. But 78 days left.
A lot of training yet behind the scenes.
Absolutely. Yes.
Well, looking forward to it. So next time we talk, we'll be down to that halfway point.
I think all of us will look a little more fatigued at that point in time. Our hair may be a little different. Absolutely. But we're getting there.
Yeah. Well, good news. Glad to hear.
Absolutely.
What else is happening at Woodlawn?
Well, we had our board meeting yesterday, and of course, there's always the financials we go over. And February was actually a pretty busy month. We did have a small operating loss of about $129,000, but overall our net income was about $249,000 for the month. We are over budget by 5.2% for the year, and 8.8% compared to last year. Physician visits were over budget about 4.1% compared to the budget. So that's we're slowly making improvements all the way around. You'll also note, our OB department. OB department was up. The number of births this now as compared to this time last year is up 20%.
Wow.
So we're making headway in all of those areas. So we appreciate everybody's confidence and choosing us for their care.
Well, also you just got done with a big renovation and some additions there too. So that's kind of nice to you got the new security in the
the new OB security system went into play about a month and a half ago, and is going well. And so absolutely. And we've got some future renovations coming up too.
Cool.
We're going to work on kind of gussying up the room, so to speak.
Refreshing.
Some nice refreshers, and so the Woodlawn Foundation is helping with that, and we're excited about that coming up as well.
Awesome.
So,
Great things happening at Woodlawn.
Yeah, absolutely. One of the things we did have approval for yesterday in the board meeting was an update of our mammography equipment. They updated the servers to allow it to be a little bit more easily accessible, and then changed it from Windows 7 to Windows 10. So, they're constantly making computer systems that we have to keep updating.
Yes,
they updated that, and it allowed the also the radiologists who are reading it to be able to access that data remotely as well, because it's going to be a cloud-based server and those kinds of things. So, excited about that. OB department, we talked about the fact that they're up 20% as compared to this time last year, but they just won the Inspire Award by the Indiana Hospital Association.
Cool.
So that is an award based on quality metrics. So an outside entity, the Indiana Hospital Association, comes in and reviews all the information and goes through the charts and checks, rates of infections and all of these different, categories. And boy, we did a great job again,
awesome.
and they won that award. So very proud of that team.
Cool. Yeah, great job for that.
They have worked really hard, as we have worked as a community, to try to increase, the volumes for that department. They've adjusted nicely and just providing great care.
Well, that's part of it too. Yeah, they've got to adjust having all this volume coming in when they're up 20% than what they were used to. That's some adjustments.
As we see the communities around us shutting down or limiting those types of services, and then Krista out here putting up billboards everywhere to try to get more volume of those OB services. We've got to have the team behind it to take care of them, and they've risen to the challenge and are doing an amazing job.
I know we've talked before too that you're always out looking for new physicians, new different things. How's any of that hiring going?
That is probably one of my biggest ongoing challenges. It really is. Finding a physician that's right for this community. And what I mean by that is we expect high quality physicians who want to be in rural communities, who want to be somewhat connected to that community, at least within a 30-minute or so drive from where they work. That's hard to do.
Yeah.
And it's not a problem just with Woodlawn. It's a problem across the nation in general. There's a shortage of physicians.
Right.
It makes it even more challenging in a small community. So we're going to keep on it, and we're going to do what we need to do. That's kind of part of the reason why we are working so hard with the rural residency thought process we've talked about. Is my hope is that in 2027, 2028, we can accept our first class of residents, and that'll give us 4 individuals that we get to work with over a few years.
Yeah.
That maybe we can show them what a great community and surrounding area this is, and we can hire some of those primary care doctors from that program.
Well, they don't necessarily hear about it somewhere they're at. They actually live it, and so then they hopefully will, like you say, enjoy it and decide that small community is where they want to be.
Absolutely. And there's a distinct difference in the type of medicine practice as a primary care doctor or provider in a small community as compared to a large community.
Right.
And what I mean by that is that my physician here in this local community, here at Woodlawn, is much more likely to do a procedure in the clinic, removal of a mole or a suspicious, thing on your skin, or do an EKG, or maybe even an ultrasound, or those kinds of things, as compared to the same kind of doctor in a large city. In a larger city, what the first thing that your primary care doctor typically does is refer you to a specialist somewhere else. Whereas our doctors cover a much greater breadth of things on a regular day-to-day basis. You don't typically see doctors in a large city who are primary care doctors who do colonoscopies, who also deliver babies, and do their own procedures in the clinics. That just doesn't happen. So it is
and then go coach baseball in the evening.
And then go coach baseball, go coach track, and those kinds of things. It's absolutely a different type of medicine, and it takes a specific person who wants that. And so that rural residency program is based on that idea.
Cool.
It's a rural residency program, meaning we want to train physicians through their residency in a community like the kind in which they'll work, so that they can get that experience.
Looking forward to more out of that coming up in a few years.
Absolutely. Absolutely. Did want to bring up our 2024 Community Benefit Report. So, community, you will be seeing this coming out in the Sentinel, as well as the Shopper's Guide over the next couple weeks. We are required, and it's just something we should do, as a county-owned hospital. But we are required to do this every year and kind of let everybody know what we do and how that benefits the community. And so as you go through the guide, you'll see things like our mission and our values. You'll see things like, oh, well, did you know last year we did 377 nuclear medicine procedures? So we give you some of the data on kind of what we do. You'll also see things like, you know, the accolades we've won. You know, did you know right now we are probably the second largest provider of OB care in Marshall County.
Yes, after the South Bend hospitals.
After the South Bend hospitals.
Yeah.
And so things like that. Well, we were the first place last year in primary care for Marshall County. So things like that are Inspire Award. And then financials we also go over a little bit to just remind people that, you know, Woodlawn is a county-owned facility, but we take zero tax dollars from the community. And that is something that is not always the case. So something nice that's going to come out, kind of give you guys an information about Woodlawn. And then, of course, we always throw in some of our fun things we did in the community, all the events and things like that. And then you'll see some of our newest providers. So
Awesome.
That'll be coming out in the next couple weeks in your local paper and the Shopper's Guide.
Good deal.
And then, you know, we always have something related to healthcare, right? We got to talk about as far as what's going on in the world.
Probably should, yeah.
So I don't know if anybody knows this or how many of you know it, but there is a measles outbreak in the United States. Primarily hitting the Southwest. There are no cases currently in Indiana. But what time are we in? Spring break time.
Spring break time.
So everybody's traveling. And so one of the reasons we brought Lindsay here today was to talk about vaccines and you know, how that affects the community. And right now with the measles outbreak, it's kind of a good idea to maybe talk about that. So Lindsay, welcome.
Thanks, Lindsay.
Hi, thanks for having me here. So one of the things I wanted to talk about is this year Woodlawn launched a community vaccination coalition to help address the vaccination rates in the community. This coalition consists of providers, health department staff, Woodlawn leadership, pharmacists, a whole conglomeration of people. So we met in February initially. We know that vaccinations are extremely important to the health and well-being of our community as a whole. Current events, hence the measles outbreak, have shown us how the community can be negatively impacted when the vaccination rates are low. You can access our community vaccination rates on the Indiana Department of Health website. It is all publicly available. One of our strategies as the coalition will be to do some public outreach about vaccination. So you may be seeing articles, interviews, podcasts with our experts. We want to help provide the opportunity to have open and honest conversations about the barriers to vaccinations. We want to make sure that the people are making informed decisions and understand the risks to themselves, their loved ones, and our community. Your provider is really the expert on this subject and should be the person that you go to have these conversations and make these decisions. They're the ones that are best qualified to give you that insight. Another goal for our coalition is to help provide opportunities for people to obtain the vaccinations. You can get them through your provider's office. The health department is also an option, particularly for childhood vaccinations, but sometimes it may be difficult to get in timely, and so we want to make sure that there's plenty of other opportunities out there. So you may be seeing or hearing about us out in the community doing vaccine clinics or health fairs just to make it more accessible to people. And on that note, we actually do have one that we're helping with next week at the fairgrounds in Fulton County from 5 to 7. It's going to be on Wednesday, April 2nd. And so Woodlawn will be there. There will be a mobilization or a immunization clinic there, a mobile immunization clinic. So lots of good stuff there. Please check that out. And, you know, I talked about the education portion. Krista here is going to be doing a podcast with Dr. Rayburn. Many of you may know him. He is one of our loved and trusted pediatricians in the community at Woodlawn Pediatrics, and he's also our county health officer. So he has a lot of great information for you, and he's going to talk about measles and the MMR vaccine and help get some of those frequently asked questions answered for the community.
I also think is really great about Lindsay and her team is that we have no cases, let me say that, but we're preparing what happens if that happens. So we have plans and we have things in place and we have our staff in place to know what to do. So I just want to applaud that, you know, we're thinking ahead and not reactive. So I think that's a really great opportunity for the community to know that we're planning ahead. We hope it never comes, but in case it does, we have some plans in place.
Well, that's one of the things. You always got to be prepared because, you know, like you said, traveling, spring break time, you never
Mhm.
know. I mean, 31, a lot of people traveling up and down. You never know when somebody's going to get sick. So you got to be prepared.
Yeah, 19 states right now currently have confirmed cases, many of them in the Southwest.
Yes.
So if you're heading to Texas, New Mexico, Arizona, those are areas that are nice and warm, and we'd all love to go right now, right? So that means, you know, you might jump on an airplane and be heading back with somebody that's got the infection. Or got
And one of the best places to keep updated on that information is the CDC. They actually update it every week, and they will tell you exactly how many cases, what states it's been in, you know, the age groups. Is it mainly kids? Is it older adults? So that's a really good place if you're wondering, do we have cases in Indiana? I'm hearing rumors. That's a really good place to check.
Absolutely. Yeah, I always say, you know, there's certain jobs in the healthcare market that you spend 90% of your time thinking of doomsday situations to try to, try to be prepared. And
My whole job.
Lindsay's is one of those jobs where she spends most of her time trying to figure out what do we do if.
Right.
And so we're happy and we're thankful for that because that's a way to help prevent issues in the county.
Yeah. Well, yeah, you definitely don't want to have to get one and then go, okay, now what do we do?
Correct.
Absolutely.
Because it unfortunately is going to get worse before it gets better if you have to think about what you got to do.
Absolutely. She's got a great plan in place.
Awesome. Lindsay, thanks for having all that information, and thanks for everything that your committee's doing.
Only other thing I have is just a reminder again, don't forget about MD Save. MD Save, capital M, capital D, SAVE.com. They are a website that will allow you to do some price comparisons for imaging services and laboratory services, and you can go ahead and prepay and get a substantial discount on those services through the website. Want to thank everybody who's been using it. They've been able to save themselves a significant amount of money, and we're starting to see them coming into Woodlawn over the last couple of months. So
Awesome.
if you need to get an MRI, you need to get lab work done, you can get on there. You can put in the name of the test that you need done, and it will show you the 5 or 6 facilities around your geographic location and what those prices are. And you should see that Woodlawn equals or beats them all, and you can go ahead and pay for that service right then. This is particularly helpful for those people who have high deductible health plans or who are self-insured or no insurance.
Yeah. Cool. Awesome. MD Save.
MD Save.
It's on our website on the main page if you need to find it.
Yeah, there's a connection on the website on our
Pretty
main
easy to
page at
remember.
woodlawnhealth.org.
All right.
Absolutely.
All right. Well, thanks for coming in, and we'll look forward to talking to you again in about a month. So it'll be about 48 days into your training.
Just keeps counting down. Absolutely.
Thank you, guys. Have a great one.
Hey, you too.
Thank you.
Woodlawn Health Report.